Thank you for joining us right here on ZTN News Blitz. We're broadcasting in Zimbabwe, in Zimbabwe's capital, Harare. Let's take a quick look at our top stories. Zimbabwe records a second COVID-19 death, 13 under scrutiny. Relief for the vulnerable as Zimbabwe unveils a lockdown cushion. Trial for coronavirus vaccine begins in September. And FIFA to allow contract extensions, transfer window moves. Now Zimbabwe has recorded its second COVID-19 death. The second victim takes the country's number of positive cases to 11. The death is that of a 79-year-old Bulawayo man who died last Saturday after being initially diagnosed with pneumonia. Zimbabwe's Health and Childcare Ministry says the patient first saw his doctor on March 23 with a sore throat and fever, and he was prescribed antibiotics but did not improve. His condition deteriorated on Thursday and he was moved into the intensive care unit and management in isolation under a specialist physician. Now, the Zimbabwe Association of Doctors for Human Rights is calling for an urgent audit for the death. Zimbabwe Doctors for Human Rights Secretary General Dr. Norman Matara spoke to ZTN.
Death and the report of the death of the second case of COVID-19. These are things that we've been talking about, and these things continue not to be addressed by the government, and they are now resulting in people dying. The first thing that we are worried about is the issue of no mass testing. You see, this patient was someone who did not travel outside Zimbabwe, and he has no links or contacts with the other 10 positive cases. So it means there is a possibility of community spread, community infection of COVID-19.
ZTN is yet to get a response from the government. Now, the Zimbabwe Congress of Trade Unions has welcomed the government's decision to pay a once-off $200 Zimbabwean cushioning allowance to vulnerable groups during the 21-day lockdown. Beneficiaries will be drawn from the Ministry of Public Service, Labour and Social Welfare database. Disbursements will be done through mobile money transfer platforms. ZCTU Secretary General Peter Mtasa spoke to ZTN.
It's actually shocking. That figure is awfully inadequate. But we like the idea that government must intervene. That is progressive. In our document, we have put 4 scenarios. The first scenario is to look at the current labor force survey, which indicated that there are almost 76% of people in the informal sector, and also which indicated the number of the employed person in this country. So we looked at a scenario where we look at the vulnerable people. If we look at the informal sector and say these are the numbers in the informal sector, these are the vulnerable people, we are advocating that the government must look at paying them at the food poverty datum line, which was about 1.8 in December 2019. I think the figure for January is now available. But this is supposed to cater for food only, and we think that is a reasonable amount. We also looked at a scenario where the government can consider using the currently gazetted minimum wage. So for workers in formal and informal sector, those informal sector whose businesses are not able to pay them the current salaries, and those who are in formal sector who live from hand to mouth, the government can consider to pay at 2,500, which is the minimum wage.
Zimbabweans breathed a sigh of relief today as the country's money transfer agencies resumed operations despite an earlier directive to go into a 21-day lockdown to curb the spread of COVID-19 pandemic. Reserve Bank of Zimbabwe Government Dr. John Mangudya instructed that NTAs operate 3 times a week to cushion locals against the economic effects of the lockdown. In 2019, the country, which depends heavily on remittances for domestic financing, earned $635 million from diaspora remittances. The number is believed to be higher as unofficial channels are also used to send money into the country. Our correspondent Ndaka Majaka gives us more.
Money transfer agencies in Zimbabwe have partially resumed operations after Central Bank Governor Dr. John Mangudjiga said such agencies would be allowed to operate at least 3 times a week from Tuesday. Diaspora remittances remain the main tool of domestic financing in Zimbabwe, with approximately $505 million received between January and June last year. The central banker said the decision was meant to allow for the receipt of foreign currency remittances, which otherwise cannot be transacted on any other digital platform. The easing of the lockdown terms shows that most African governments are facing a very delicate balance as they try to curb the spread of the coronavirus as well as keep their economies running. We come back to you in the studio.
Now, fresh food markets in Zimbabwe reopened on Monday. Traders and farmers have started generating income again, with some recording losses as their produce was going bad after being stored for too long. However, our news team visited one of the markets, Msika, and they discovered that it is not the loss of revenue that is of major concern, but the lack of social distancing that can cause a rapid spread of the virus. Takuti Ambakwe gives us more.
It's day 10 since President Mnangagwa activated a 21-day lockdown in Zimbabwe. While this is a noble move to curb the spread of the coronavirus, the country's highly informalized economy is struggling to cope. This has caused the president to order the reopening of fresh farm produce markets, as farmers and traders were now seeing their produce rot as they could not sell to anyone. But a visit to one of the country's busiest fruit and vegetable markets, Msika, shows that reopening the space was not really a good move, as hygiene levels are low and people are not observing social distancing. We spoke to some of the traders there, and this is what they had to say about their understanding of the matter. We also spoke to City of Harare authorities who were present at the marketplace, and they said more needs to be done to educate the people on the importance of social distancing.
Yes, we are concerned as well with social distancing. Here at Msika, we have seen the enforcement was not that strict, but it was very, very strict and very visible at Lusaka Market in Highfield. So we are instructing our police officers to liaise with ZTN so that we can adhere to social distancing at all our markets and minimize the number of people getting into the market at any particular time.
But does social distancing really matter?
COVID spreads mainly by droplet infection. If I cough, if I sneeze, those droplets can go for a space of about 1.5, 2 meters. So if you are beyond 2 meters, the risk that you'll be infected by somebody who is infected is much reduced. So that's why we recommend social distancing.
Whilst opening the market ensures that traders still earn a living that enables them to fend for their families, there is need to ensure that at such places, social distancing and hygiene standards are maintained. Takuchi Mbakwe for ZTN News in Bare.
Still with the virus, experts have warned that people may face increasing mental health issues during the COVID-19 pandemic. They say this public health disaster may take a toll on people, particularly those struggling with common mental health disorders such as anxiety, depression, and other conditions. According to the Ministry of Health and Childcare, an estimated 1 million Zimbabweans suffer from mental health neurological disorders. ZTN caught up with psychiatrist Dr. Rukudzoma Mukatsungu.
Thing that actually there is more of the indirect effect through the stress that the COVID-19 is actually causing, because it is global. There is no treatment for it, and there is a lot of uncertainty around, getting, be it vaccines or actual treatment for it, and whether you survive or not. So mainly it's about the kind of stress that it causes psychologically.
The Employers Confederation of Zimbabwe has called on companies to preserve jobs where possible, despite facing various challenges to pay salaries after the coronavirus-induced lockdown. This comes at a time when some companies have mooted retrenchments, especially those in tourism and hospitality industry. MCOR's President Israel Murefu says some of the actions are understandable, and as the tourism sector is on complete shutdown, there is need for companies and employers to dialogue.
Obviously, this is a very difficult period for both business and employees. What we would expect is that if there is any business that wants to do anything from a labor market perspective, they should do it in terms of the laws of the country. But we would advise employers to exercise caution as much as possible and try to save jobs if they can. At the moment, we are trying to develop a position as a tripartite, and we think that probably by tomorrow or Thursday, the tripartite negotiating forum would have come up with a position which should be sent to all businesses and social partners as a guideline. But I don't think there is any law that has been promulgated which suspends the current laws, the current labor laws in the country.
Now, health experts have warned that people living with HIV who are not on treatment or virally suppressed may be at greater risk of developing severe symptoms of COVID-19. It is against this background that the United States government, through the U.S. President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, has set aside at least $150,000 United States dollars to help with COVID-19 prevention measures in Zimbabwe, specifically targeted at people living with HIV. An estimated 1.3 million people are living with HIV in Zimbabwe, and just over 80% of that number are on treatment. Deputy Public Affairs Officer at the United States Embassy in Zimbabwe, Jason Roberts, spoke to ZTN.
This PEPFAR funding includes the purchase of soap, buckets, hand washing stations, and hand sanitizer for supported facilities, and the reproduction of COVID-19 communication materials to be shared at supported facilities and through faith and community networks around Zimbabwe. The United States is committed to continued care and treatment for people living with HIV in Zimbabwe.
Jack Dorsey, the founder of Twitter and payment app Square, will donate $1 billion United States dollars towards efforts to tackle coronavirus. Dorsey says the donation represents 28% of his wealth. He made the announcement on Twitter, writing that the needs are increasingly urgent. Mr. Dorsey did not say exactly where the funds will be sent to help in the battle against COVID-19. And in the U.S., there is a shortage of ventilators and personal protective equipment, and business and individuals are also struggling economically. Johnson & Johnson has announced that it has selected its lead candidate for COVID-19 vaccine after preclinical research. Johnson & Johnson and the U.S. Biomedical Advanced Research and Development Authority have committed more than $1 billion United States dollars towards the research and development of the coronavirus vaccine. Johnson & Johnson Global Head of Viral Vaccine Discovery and Translational Medicine, Hanek Shootmaker, speaks.
We are now preparing our vaccine candidates to be tested in a first-in-human trial, as we call it. So the first time it will be administered to people. From that, of course, we want to get an idea of the safety of our vaccine and also of its ability to elicit an immune response. And as soon as we have that information, we may enter into what we call an efficacy study, and that is a study to demonstrate that if it gives an immune response, whether that immune response will protect against COVID-19. Currently, we already have a pilot or a launch facility available where we can manufacture at 1,000-liter scale, and that would give production of 300 million doses per year. But of course, on a world population of 7 billion, that's far from enough.
And now for a bit of sport. FIFA will allow the July-August transfer window to be moved and has recommended that player contracts will be extended until the season ends. The announcement was made following consultation between FIFA's Football Stakeholders Committee and representatives of clubs, players, leagues, national associations and confederations. By extending existing contracts, new contracts will not come into force until a new campaign begins. FIFA has also encouraged clubs and players to find payment solutions while football is on hold, but has said it will arbitrate when a solution cannot be found. The South American Football Confederation, Conmebol, has reported record annual revenues of $509 million for the year ending last December, more than double what they generated in 2018. The federation has reinvested 93% of the money back into football and has created a $27 million reserve fund to help it face contingencies that may arise, such as coronavirus. And that's all we had for you right here on ZTN News Blitz. We're back again tomorrow. Keep watching ZTN.